afternoon, ma'am, and all my friends. I'm Dulani Sangmar, number 13, student of Woodland Institute of Nursing. I'm going to give her talk on diarrhea. Now let's start with the definition of the diarrhea. Definition: diarrhea is defined as a passage of unusually loose or watery stools, usually at least 3 times in a 24-hour period. Now let's see the signs and symptoms of the diarrhea. What are the signs and symptoms of diarrhea? First, we'll see the dehydration. The dehydration in the adults, there will be a thirst and less frequent urination than usual, dark color urine, dry skin, fatigue, and dizziness. Now let's see the signs and symptoms of in the children. What can we see in the signs and symptoms in the children? There will be a dry mouth and tongue in the tongue, no tears when they are crying, and no wet diapers for 3 hours or more, sunken eyes, cheeks or soft spot in the skull, high fever, restlessness or irritability. Here in this chart can be seen signs of dehydration in the children, which can be seen sunken fontanelli and the reduced level of consciousness, dry mucous membranes in the mouth, and reduced tissue turgor in the tissue in the skin will be dry. There will be a tachypnea, and eyes will be sunken and tearless. Then reduced capillary refill timing. Then tachycardia, hypertension, peripheral vasoconstriction, sudden weight loss, and there will be a oliguria, absence of urine. Now let's see the causes of diarrhea, how it causes the diarrhea. Food intolerance or allergy, irritable bowel syndrome IBS, inflammatory bowel disease IBD, infection by bacteria organisms, and perform toxins, eating foods that upset the digestive system, medications, radiation therapy, malabsorptions of foods, then foods with contamination of water, food, or hands for mites with infective cysts and trophozoites. Trophozoites are also passed in stool, but they do not survive in the environment. That all are caused by the cause to diarrhea. Now, how we will manage the diarrhea? We can manage diarrhea with 3 things: ORS, oral rehydration salt, plus fluids and foods. Now let me tell you about the oral rehydration salts, that is ORS. In this ORS, it is a balanced mixture of glucose and electrolytes. Almost all deaths from diarrhea can be prevented by ORS. Then in this ORS, sodium promotes absorption of water from the intestine. Glucose promotes the absorption of sodium and water from the intestine. Now let me tell you the rice-based ORS. Tests better and provides more calorie than the glucose-based ORS, is the oral rehydration salt. And culturally acceptable it can be. Then reduces stool volume, shortens the duration of diarrhea in both cholera and other several diarrheal diseases. Starters other than rice, including wheat, flour, and maize, have also been shown to reduce stool volume in patients with cholera. Reduce diarrhea by adding more substance to the gut lumen without increasing osmolality, thus providing additional glucose molecules or for glucose mediated absorption. During the diarrhea for the children, what should be fed? Now let's see. Children should continue to be fed during diarrhea. Milk should not be diluted with water during any phase of acute diarrhea. Milk can also be given as milk cereal mixture, example Dahlia milk rice mixture. This technique reduces the lactose load and preserving energy. Foods which should be avoided during the diarrhea: milk, Dairy products, fried, fatty, greasy foods, spicy, dishes like pork, sandwiches, raw vegetables, corn, oil, citrus fruits, other fruits like pineapples, hummus, seeded or berries, grapes, alcohol, coffee, soda, and carbonated drinks, artificial sometimes. Then, what other foods should be taken during the diarrhea? Uh, to make foods energy dense, some of preparation are khichdi with oil, rice with curd and sugar, mashed banana with milk or curd, mashed potatoes with oil, and breastfeeding should be continued uninterrupted even during rehydration with ORS. These things should be taken during the diarrhea, and it prevents and it makes cure uh, from the diarrhea. Next, I'll start with the next disease. It is hypertension. Hypertension, also known as high blood pressure, that is HBP, is a long-term medical condition in which the blood pressure in the arteries is persistently elevated. This systolic blood pressure SBP will be more than or equal of 140 millimeter of mercury, and diastolic blood pressure will be more than or equal of 90 millimeter of mercury. Now let us discuss the causes of hypertension. There are some causes which can cause hypertension. In the age also, chance for CAD after 50 years of age. Then alcohol, those are smoking, and diabetes mellitus, excessive dietary intake of sodium, gender, in the family history, and obesity, kidney disease, and prolonged mental tension, sedentary lifestyle, and stress. Now let's see the dietary management for the hypertension, that is diet. First is energy. An obese patient is reduced to normal body weight with low calorie diet, and alcohol consumption should be reduced. Then protein. Next is a protein. A diet of 60-gram protein is necessary to maintain proper nutrition, and in severe hypertension, protein restriction to 20 gram is required as a temporary measure, since protein foods are rich in sodium. Next, we'll see the fats. As they are prone to atherosclerosis, it is advisable to avoid high intake of animal or hydrogenated fat. About 20-gram vegetable oil is permitted. Omega-3 fatty acids has a role in regulation of blood pressure. Next is the carbohydrate. Easily available carbohydrate is of great help in management of high blood pressure. Next is the sodium. Increased sodium intake leads to increased intravascular volume, and this increases cardiac output by elevating blood pressure. Restricted sodium and decrease in sodium potassium ratio in diet. Moderate sodium restriction 2 to 3 gram per day. This reduces diastolic pressure, and sodium restriction accompanied by weight reduction effectively control mild to moderate arterial blood pressure. Next is potassium needed in the hypertension. Potassium works with sodium to regulate body's water balance. Low level of potassium causes the body to retain sodium and water, and this can elevate blood pressure. Research shows that a high potassium to sodium ratio is associated with a greater likelihood that the normal blood pressure will be maintained. And instead, potassium rich foods such as leafy green vegetables, root vegetables like potatoes and carrots and fruit should be eaten every day to meet the potassium requirement. Next, calcium needed in hypertension cases. Intake of calcium has blood pressure lowering effects. It is involved in the control of strength with which blood is pumped by the heart and the flow of blood in the veins and capillaries, both of which contribute to blood pressure. Next is foods to be avoided. Salt in cooking or at the table. Ajinomoto, baking powder, preserved foods such as pickles, canned foods, potato chips, peppers, ketchup, sauce, baked foods such as biscuits, cakes, peanut, butter, frozen peas, shellfish and dry fish, etc. All this should be avoided in the hypertension cases. Now let me talk to you the DAS diet, that is dietary approach to stop hypertension. The DAS diet is rich in fruits, vegetables, whole grains, and low fat dairy foods. Includes meat, fish, poultry, nuts, and beans, and is limited in sugar, sweetened foods, and beverages, red meat, and added fats. It is a dietary pattern promoted by the US-based National Health. Thus, is a dietary approach to stop hypertension is a flexible and balanced eating plan. It has been proven to lower blood pressure and cholesterol. In addition to being a low salt plan, the DAS diet provides additional benefits to reduce blood pressure. It is a high fiber, low to moderate fat diet, rich in potassium, calcium, and magnesium. Diet suggested by the DAS, that is in the grains. Grains include bread, cereal, rice, and pasta. And grains are naturally low in fat, so avoid spreading on butter or adding cream and cheese sauces. In the vegetables, tomatoes, carrots, broccoli, sweet potatoes, greens, and other vegetables are full of fiber, vitamins, and such minerals as potassium and magnesium. Example, often serving include 1 cup raw leafy green vegetables, half cup cut up raw or cooked vegetable. Then fruits which can be taken in the hypertension suggested by the DAS diet. Many fruits need a little preparation to become a healthy part of a meal or snack. Like vegetables, they are packed with fiber, potassium, and magnesium, typically low in fat. The examples of one serving fruit, 1 medium fruit, or half cup fresh fruit. Then dairy, which can be suggested. Milk, yogurt, cheese, and other dairy products are major source of calcium, vitamin D, and protein. Then among the meat, lean meat, poultry, and fish, meat can be a rich source of protein, vitamin B vitamins, iron, and zinc. Alcohol and caffeine. Drinking too much alcohol can increase blood pressure. The DAS diet recommends that men limit alcohol to 2 or fewer drinks a day, and women 1 or less. And in the fiber, getting a recommended daily amount helps you feel full and promotes good digestion, thus provides more than enough. Nuts and seeds and legumes, almonds, sunflower seeds, kidney beans, peas, lentils, and other foods in this family are good sources of magnesium, potassium, protein, and full of fiber and phytochemicals. Here I would like to conclude my health talk. First of all, I would like to thank Manbarbara and all my friends.